The importance of direct access in physical therapy. What is direct access? An article written by Oxford Physical Therapy stated direct access means the removal of the physician's referral mandated by state law to access physical therapist services for evaluation and treatment. Paragraph 1. In other words, direct access is a way physical therapist is allowed to diagnose and create a plan of care without a doctor's referral, allowing for patients to come directly to a physical therapy clinic without needing to go to the doctors first. Not only is it mandated by state laws, but some insurances have strict policies against direct access. What is a referral? According to the Peterson's Physical Therapy, this is what they stated a referral is. A prescription is a written directive from a healthcare provider that outlines the specific treatments or interventions a patient should receive, whereas a referral is a healthcare provider directions to their patients to seek physical therapy. The prescription is simply the written instruction for the healthcare provider to the physical therapist himself. Why is direct access so important? It is cost efficient for a patient due to not having to go to a doctor's office before having to go to a physical therapy clinic. This means that most insurances require a copay or a deductible to be paid before being seen by a doctor. Eliminating the step of going to a doctor's office for a referral would mean that they would not have to pay their copay or a deductible until they went to a physical therapy clinic, reducing one less payment. It allows a patient to get treated faster and reduce pain. Many patients have to wait for an appointment for a doctor to get treated or get prescribed a referral, when instead they could be headed to a physical therapy clinic and help get rid of the pain faster. Many patients rely or take pain medication. Getting in and treated faster would reduce the amount of pain medication needed or patients relying on pain medication. It allows a physical therapist to be able to treat more patients. Taking away this step would mean that physical therapists would not have to wait for a referral in order to treat a patient. This would speed up the process for patients to be seen and for physical therapists to be able to see more patients. How is it more helpful for the patient? From an article written by Foothill Sports Medicine and Physical Therapy, they stated a couple examples of how direct access can benefit the patient. Here are some examples of them stated in the article. Having more control in your own care, deciding how you want to be treated. Meaning, if you want to go to physical therapy, you can. Physical therapists have plenty of education to diagnose and treat your injuries. Physical therapists go through having to go to 2 years in a bachelor program and then having to get accepted in a doctorate physical therapy program, which lasts about 3 years. Faster process, so they are very educated. Faster process, limiting the need to go to a doctor's office in order to get a referral to get treated. Like I said, eliminating the step would mean you would get into a physical therapy clinic faster and treated and feeling better faster than if you would have to wait to go to a doctor's office. Faster results. Physicians occasionally like to try other methods before they try physical Sometimes physical therapy isn't the answer, so physicians like to try other methods like medication. And if they seem like it's worse, they would like to try surgery or other methods. What is stopping us from direct access? All 50 states allowed direct access, but each state has different laws and restrictions against it. Insurance influence or have strict policies not allowing physical therapists to have direct access, but instead for the patient needing to go to the doctors first. This would mean that a physical therapist would need a referral in order to treat a patient, which means a patient would not get their treatment paid for unless they went to a doctor's office to get the referral. Cons of direct access. Many believe that physical therapists aren't educated enough to be able to diagnose and treat. Potential costing more if not treated correctly. Possibility of a physical therapist misdiagnosing. Potential of over workload for a physical therapist due to having more evaluations. These could be the cons. These are some of the cons of direct access. How can we help? We can educate the people about the benefits that direct access has. Not many know what direct access even is. So helping people understand what it is can help promote. Help promote the removal of restrictions on direct access through those and physical therapy associations and insurance policy makers. Insurance policymakers make it really hard for physical therapists to allow direct access due to their strict and harsh policies needing for their clients to go to a doctor's office before they are allowed to be treated in physical therapy. Once again, highlight the benefits. Let them know that research says it improves faster results and less money spent. We all want to get healthier faster and reduce the pain. So if research says, studies show that it improves, it is a great way to promote direct access. And everybody loves money, so spending less money on your care would be beneficial because healthcare is expensive, and many more benefits that direct access can come with. These are all my sources that helped me with this presentation.